Hello, my name is Dr. Megan May, and I wanted to make a short video to talk to people about the new polio-like illness that has been hitting the news lately. What this is, it's very important to emphasize, is not polio. Let me say that again. It's important to emphasize, this is not polio. There are no cases of polio going on. What it is a group of infections called acute flaccid myelitis, or AFM for short. These guys look exactly like polio, but they're just caused by different viruses. Okay, so this has nothing to do with polio vaccines or resurgence in what we think of as a disease that's been eradicated from the Western Hemisphere. Nothing to do with that. However, still kind of scary. So let's talk about it and sort it out. AFM is, as a presentation, pretty scary. It's going to occur almost exclusively in children. And in fact, in the US this year, we've had 50 cases as of August. That's the latest available information that we have. This goes after 2014, where we saw a big spike in cases all of a sudden, and it's not really clear why that is. But what is AFM? How does it present clinically in a child? Usually what you'll see is a kid, maybe 3, 4, 5 years old, and they don't feel particularly well. They're just kind of cranky. They might have a low-grade fever in kind of the 99-degree range. They may have a little bit of nausea, not want to eat, and then all of a sudden, out of nowhere, they'll have this extreme weakness in their arms and legs, and they can't move them anymore. Their arms and legs are still movable by somebody else, but the children themselves have a difficult time getting their limbs to move. That's why this is called a flaccid myelitis, or a flaccid paralysis. It's the difference between my arm being stuck like this and nobody can move it, or my arm being stuck like this and somebody else can come along and pick it up and move it around. Okay, so that's kind of clinically what we're talking about. Obviously, if you found your child in this kind of state, that would be quite terrifying for you and for them. So what ends up happening in this case is typically, rush to seek treatment, and it becomes clear that this is a viral infection. So what causes this? And why are we seeing these spikes all of a sudden? So, as mentioned more or less at the top of this video, the most infamous cause of this type of disease is the virus polio, or poliovirus, I should say. However, we don't have that circulating in the United States. That's not what's going on here. What's going on here is that some related viruses called enteroviruses and some much more distantly related viruses called adenoviruses are probably what is facilitating these infections. And those are big, broad categories. So there's not one smoking gun here that seems to be causing this spike in cases. That's an important thing to point out. On the one hand, it makes it a little reassuring that this is not resurgent polio. On the other hand, it's a little nerve-wracking, right? Because we don't know what exactly is causing these cases. All of the cases have been reported to the Centers for Disease Control, the CDC. Clinical material from all of these patients, that includes blood, saliva, urine, spinal fluid, everything has been sent, and when they've been examined, the CDC has not been able to come up with one single infectious agent that's causing all of these cases. So that means one of two things. The first is that this is something completely new that is somehow escaping every single method to detect new infectious agents, which is certainly possible, but not likely. Or this is a few different things that are causing this presentation that are all happening kind of temporally synonymously. So everything's going on at the same time. Turns out that makes a lot of sense, and the reason for that is the time of year that it is. The majority of the cases in 2016 have started happening over the summer. Same thing happened in 2014, so these cases went up and up and up and up and up over the summer, and then September, October, they started to fall off a cliff. That's exactly, by the way, the epidemiology that polio had. It was thought of as very much a summer illness. But enteroviruses and adenoviruses, because of the way they're spread, very much the same story. So you can spread them by direct contact. And children are really, really good at this, both by sharing toys and by something called the fecal-oral route, which unfortunately is exactly what it sounds like. That's how enteroviruses are spread. So if you have children that are, say, in diapers in a swimming pool, or not washing their hands after they're playing with other children, it's very easy to have these things spread from one kid to another. All that said, seeing these all at the same time, we usually think of that as, oh, these cases must all be related. They must all be caused by the same thing. And in this instance, it may not be the case. All that said, there's also been a lot of talk about something called enterovirus D68. This emerged in the United States a couple of years ago in 2014, and most of us heard an awful lot about it in terms of it being this scary new emerging disease, and for most people it caused common cold symptoms, but there could be these complications. The thought was that AFM was one of these complications. That hasn't been proven definitively. In 2014 especially, many of the patients did seem to be infected with enterovirus D68. However, in 2016, that doesn't seem to be the case. So it really does seem to be a very similar clinical presentation that we can't ascribe to one single thing. That said, it makes things a little bit tricky, because if we knew there was one single thing that we needed to be careful of, we could make a nice diagnostic test, we could start monitoring for it, we could try to rapidly produce a vaccine for it, and remove the problem altogether, or at the very least monitor it and let people know, oh, there's a case of this in your community, you should be careful, you should take good precautions. But unfortunately, if it's a bunch of different things, or if it's a new thing we haven't discovered yet, we can't really do that. And so we're left to this slightly helpless feeling of, oh man, then what do we do? The good news is these viruses tend to all be spread the same way. And the single best thing you can do to prevent this type of virus spread is to wash your hands. Use good hygiene. And that's a soap and water, happy birthday song, timed hand washing event. Since we don't know what exactly is going on, that's the best thing we can do in order to prevent it. I hope that helps. So if we hear anything scary about polio, remember, it's not polio. It clinically looks a bit like it, but it's not polio. And we don't know what exactly it is. Potentially it's one of a few things. And finally, last but not least, stay safe. Wash your hands. All right? Hope that helps. Bye.